on as we go. Perfect. First of all, thank you guys all for joining. We'll try to get out a little bit before 1. I was just going to have some brief background updates before we go into the specific breakout sector updates. First of all, we loved everyone who was able to join us at the end of August for our presentation by Dr. Lisa Bailey-Smith, who came from Geisinger Health Center. She was able to talk to us about their healthy lifestyle questions that they've been doing at their health system, which is delivered to, gosh, I don't even remember, like 20 to 30 different clinics in the area, focusing on healthy lifestyle questions, physical activity questions. Those questionnaires are delivered electronically. And so there's about a 50% completion rate, which is still pretty good. And then also patients have the ability to complete the surveys when they get into the room as well. This is a little bit different than our 1, 2, 3, 4, 5 Fitastic that we're using at the PCC. We're trying, hopefully, we're trying to get it electronically or a little bit easier to access. But right now it is delivered by our care assistants who check in the patients for their well child checks. But the benefits of that is everyone gets screened and every language. So that was a little bit different. Theirs was only in English right now. So just, it was really interesting to hear from her. If you guys have any questions about that, you can listen to the recorded meeting. And then we had our kind of our big breakout summit that happened in September. We had about a 3-hour session where we were able to break out and do some like cross-sector collaboration based on our interests. And that was really fun. We came up with some good ideas. And again, if you're interested in listening to that recording, please let us know. We do have a YouTube channel, so you can access those that way. Shelly, was there anything other major that you wanted me to talk about for those 2 things?
Not for those 2 things.
Okay, perfect. And I was going to save the other thing for kind of after our updates. So Dave, since I see you first, would you like to go first?
Yeah, sure. So
just tell people about your kind of background, since we have some new people here too.
Sure. So my name is David White. I am exercise physiologist and researcher in Children's Mercy Heart Center. The group that I am leading is the Healthcare Billing and Reimbursement group, focused on billing and reimbursement for exercise and physical activity counseling and assessment in clinical settings. Where we've done what we've done with that so far is we've had several meetings to kind of figure out the best pathway to figure out the billing and reimbursement issue. And I see Dan's on here too, and he's been involved in some of these conversations, and found that, you know, I have no surprise, billing and reimbursement is a big rabbit hole that is a hard one to navigate. But one pathway that we think might be a way to go is remote monitoring, the remote patient monitoring codes. And we developed a project called remote exercise prescription, or REPS, and it received some seed funding, and in July, I believe it is. And it's more or less, the concept is it's remote patient monitoring, exercise counseling, and exercise prescription. And we're working to develop that in such a way that it specifically meets the remote patient monitoring code requirements. And then we're talking about trying to do that in such a way that it's a QI project first to kind of proof of concept. But so that is kind of where our group is. But another thing that I'd like to bring the billing group back together, Dan and everybody else, is to talk about another option of like time-based billing, and including exercise counseling in a time-based billing model, and how that would work. So possibly another pathway there. That's really it. That's all I got.
Perfect. Thanks, Dave. And if any of you are interested in hearing more about these subgroups or want to enter into the subgroups, you can also put that in the chat as well, or reach out to Shelly or myself. And then Jay, I see you're on here, so why don't you go next?
Yeah, my name's Jay Robertson. I'm one of the sports medicine physicians at Children's Mercy, and I've been working on, for the healthcare part, been working on kind of the exercise medicine curriculum, which is sort of evolved potentially into sort of a lifestyle curriculum thing. And I had a really good meeting with Dr. Geetha Kamath over at University Health, and she's highly involved in some of the curriculum stuff over there, and a couple of programs, and the CPM 1 class, so the clinical practice of medicine 1. So they kind of do that first semester of the year. And I just got her, she sent me an email not too long ago. And she and I, again, had a really good meeting, talked about ways to kind of get exercise into the curriculum, and some exercise education into the curriculum. And she was all about it. She actually did some lifestyle medicine training, so she really wants to focus on this and make this part of the standard curriculum. So the problem is still, for this whole year, they've already kind of set the curriculum and the times and what everything's, the hours per week and stuff that they're working on. So she thinks it's a perfect opportunity to add something into her lecture, like expand her lecture. So me or somebody else, anyone could come and give the exercise portion of it, and do maybe 1 or 2 hours throughout the first year, and just kind of get it rolling on that. But yeah, she's lifestyle medicine trained. She's had an extra certification about it, or certificate of added qualification in lifestyle medicine onto her internal medicine background. So that was kind of the perfect person to talk to. And she's also on the curriculum board too, so she can help kind of plan things and make it happen. So it was a good meeting.
Awesome. That's a great update, Jay. Thank you so much. And Christina, this could be something that maybe you would be interested in, but we're obviously not only focusing on medical schools, but we'd like to have like nursing, pharmacy, PT, OT. So if this is something you're interested in, we can definitely join your name to that group. All right, so I'll go do the next update. So I guess I didn't introduce myself. I'm Jody Dickmeyer. I'm a pediatrician at the PCC and the director of our bilingual clinic there as well. I am heading up the Just Walk subgroup. And so it's kind of also Walk with the Doc is the big name. Just Walk just means that we are including extra healthcare specialties into being able to put on this walk. And we've had a lot of people giving our health topic. So we started in April. We're still doing every month. We meet at Pearson Park from 9 to 10 a.m. on the second Saturday of every month. And we've started to get some really good involvement with the community and people who are living over by Turner Park. Turner Elementary and Turner Middle School are right there, Turner High Schools as well. But we did have to put it on hold for October because apparently there was a big car event there. So we did decide to cancel the October event just because there wasn't really any access in and out of that park. But we will have it starting back up in November. Myself and Helena LaRoche are currently signed up to help with that walk. We can always use extra volunteers, and we will need extra volunteers to help with the children's activities. We usually have the kids kind of split off into the tennis courts play area, and they do some healthy lifestyle tag and games and different things like that, while their parents are able to talk with us and walk for about 45 minutes. So if anyone's interested in volunteering for that, helping with that, please let me know. But I am really excited. I hope we can keep up the momentum for the winter, trying to keep people walking outdoors. So that's my update.
Well, 2 other things with that. One is if you're interested in joining that group, the Just Walk group is meeting next Tuesday morning. We meet about once a month, generally a Tuesday morning at 8:15, 30-minute meeting just to sort of cover the upcoming walk. So we'll be talking about the November 12th walk. And again, if anybody's interested in learning more about the format or is interested in participating, attending that meeting, we give you some additional information. So just put your name in the chat and I can add you to that meeting invite. The other thing that we're trying to do is coordinate with other walks that are occurring around the city. Right now, we have 3 other walks that we know about that are happening on a regular basis. One is led through KU Med Center. One is led through Dr. Stephanie Ellison at University Health and the UMKC School of Medicine. She's partnering, or there's a partnership with AARP, and they are leading walks. I think they meet at the Southeast Community Center, so that's in Kansas City, Missouri. Jay, tell me if I'm saying her name right, but I think it's Meg Gibson, sports medicine physician, also with University Health. She's leading a walk, I think I never know if I should say University Health or Truman, or if they're the same thing or something slightly different, but at their Lakewood
University
campus.
Health now.
Okay, good. University Health Lakewood campus, they are leading walks on a regular basis. So there are 4 walks that we know about happening at least monthly. We're generally on different weeks. So if you attended multiple ones, you could be walking every Saturday. Well, not every Saturday, one's happening on a Wednesday, but multiple times a month with a group of people that are also interested in walking and receiving additional healthcare information. We have those dates and more information in our healthcare sector newsletter. All of you should be receiving that, except maybe Christina and Caitlin. I don't know if we've added you guys to the distribution list yet, but we're happy to do that. But I just wanted to let you know that we're trying to coordinate with those. If you know of other walks that happen on a regular basis that we are not aware of, please send them to us and we'll include them and reach out to those groups to try to do a better job of coordinating our efforts so people have opportunities to walk in an area convenient to them.
I think one idea I'll just throw in, because I love the idea of those, multiple. You've got Southeast, you got Pearson over there in Wyandotte, and then I can't remember where the other, Lakewood, and then the one in between. I can't remember where you said it was.
They change their park. That's KMed. They change their park. Their walks are always in KCK, but sometimes at different parks.
At different locations. That's kind of cool. I like that idea. And the other thing that might feed into it, that might be a good add-on, is with a little bit of nutrition counseling, or because that's all exercise and good diet, is tie in with the farmers markets, because usually they're kind of centrally located as a place to stage stage walks too. I don't know if that's something. I know at one time there was some talk about doing some events within the farmers markets and I think they have some incentives like SNAP discounts and things like that. I just throw that out.
Yeah, that's a great idea. Sounds like Dan is starting our next walk location.
I am. I have a couple locations too.
That's awesome. I love that idea. And we had actually talked about, it would be fun to have some like people coming to these walks, not necessarily like vendors, but like you said, like different tents, almost make it like a mini health fair. That's something we could continue to explore maybe in the spring or summer, and joining some of those, like the bike rodeo, if we could join some of those things to the walks as well.
Yeah.
But we do have dietitians coming to our walks, and they have led some of our healthcare topics too. So they have been talking about healthy lifestyle, nutrition.
Yeah.
So, yeah, great suggestion. Anyone else have any suggestions or comments? Well, I guess I will move into the last thing. Let me see if I can share my screen. I'm going to need this, Shelly, and you can help me out. Can you guys see this? Okay, great. So Shelly, you can help me walk through this because I was not able to attend the core meeting just this past week, but some very, very exciting stuff for us and things that definitely started my wheels turning about different projects and implementation projects we can do. So we now have funding that we can actually put behind some of these projects, which is very exciting. So each of our breakout sectors, so our healthcare sector, can bring a project to the core work group. The first one is going to be, is it November? Sorry.
First meeting that we'll have to review projects will be in December.
Yeah, December, sorry. And then quarterly after that. So it's at the bottom, December this year, then March, June, September, December. And so what we want to do is look at our projects and implementation ideas and try to make sure that we are incorporating, this goes way back to the beginning, but those like 4 principles that we talked about a long time ago as far as like, modeling, healthcare, preventing chronic disease, if you guys remember those 4, I don't even remember them myself, it was so long ago, but we've been doing them with all of these projects. So again, looking at the highlighted versions here, individual or interpersonal behavior, built environment design, organization and advocacy, and then policy. And then there will be some emphasis, especially if you have cross-section integration. So I know that, Shelley has already worked with our faith group and Stephanie Ellison to do a walk together. So that would be prioritized more so than just doing it yourself. So we want to start thinking about how we can incorporate some of the other sectors with us. And then that money would be kind of shared between both the sector groups. And if you see at the bottom, right now, there's $10,000 available for each sector in the initial round, hoping that additional funds will come through. And we do not have to do one project of $10,000. It could be 2 projects of, 3 and 7 or 5 and 5, however we want to decide that. But, with the different things that have been going on, I just think that this is really exciting that we could put something behind it. And, just in my mind, talking about with you, Dan, like, could we do a bike rodeo? And maybe some of those funds are going to go to helmets and, maybe a bike giveaway or something like that.
Safety. And that leads into my next segue. I just donated a bike to the Kansas City Police Department. I don't know if anybody caught it on the news, but we've been working. I did a study with the bike patrol. They're located in the Central Division, the Kansas City Police Department Central Division, and they spent 6 months testing our bikes. We had 2 bikes that they were using to, because a big part of it is safety and knowing if you're out walking and biking that there are, not that there's a police presence, but that there is safety. There is a patrol, and it really comes into the safety piece of whether you're in parks, that there's that kind of component. So we did a survey and got their feedback on performance and use and how they work. So I thought that was, I really enjoyed working with the department.
And I know that other residents in the past have done projects like with soccer balls. They like bought a bunch of soccer balls and did a program with kids. So I'm trying to reach out to residents to see if there's anyone who's interested in this. I know, Jay, a few residents who are kind of interested in the sports medicine aspect. Could we collaborate with them? Because I think it would be nice to get some of our learners involved in these projects as well.
Yeah, I know there's also Bike Walk KC, which is our big, I know I'm stuck on bikes, but I think walking, biking, skipping, running, however you get there, as long as you're moving, that's the end goal. And different there's a lot of different programs and things that could tie in, like we mentioned the nutrition piece, park and recs, and then Bike Walk KC, they do a little safety thing, like how to fix a bike. So it's a little bit of education, especially for the children, starting early. Hey, this is a way you could have fun learning and kind of have a little skill set. And they do little trainings throughout. You'll see them posted every so often, but Bike Walk KC is a big advocate for. They do them out at the Johnson County library parking lot, and they're banging on bikes here. So there's those events that kind of tie in.
Yeah, that's great. And I love that because that is very cross-sector.
Yeah.
Jay, were you going to say something?
No, I was just going to say that I'm sure the residents would be happy to be involved, and they might have some good ideas.
I'm sure I could get Andrew involved for sure. He'd be up for it. And then other things, do we have some kind of walking path and then meet up at the community garden that Shelley is so wonderfully versed with, again, including that healthy nutrition with physical activity. So just if you guys, Girls on the Run was another thing that was thrown out there. I know there's a lot of unique organizations out there. But if you guys have any ideas, please send them to us or speak up. Now we have a few minutes to discuss this.
Yeah, if you don't mind, I'm going to give you a little update on what's happening with the Girls on the Run team that meets in the Children's Mercy Garden. We, I don't know are all of you familiar with Girls on the Run? Yes,
Yeah.
I see subtle head nods, I think. Okay.
I would just
So-
give a quick update real quick. Yeah, just
Girl-
let them know.
Yeah, Girls on the Run is a national program. They meet typically at schools and have volunteer coaches who are training girls in an 8-week program, both on physical well-being, so training for a 5K, but also social, emotional, and mental health training as well. So there's a curriculum that's tied to it. They learn a little bit about how to take care of themselves, how to be advocates, how to be healthy. They can, like I said, they typically meet in schools. We have a group who has chosen to meet in the Children's Mercy Garden. So their sessions happen in spring and fall. We are currently in the fall session, wrapping up the fall session. With that group of girls, in addition to learning about gardening, we are teaching them a little bit about youth advocacy. And as part of that, they are going to conduct a walk audit with us. They did an initial one in the spring. It was sort of our first foray into this, and it was really a practice. We only had 6 girls attend that session where they did a walk audit. This one, we have a few more. So we hope to have at least 8 girls conducting the walk audit. We're doing it in and around Children's Mercy and the Health Science District. We are going to be auditing the Children's Mercy Garden and the Ronald McDonald House gardens. They actually have 2 gardens over there. One is more botanical, one is more growing food. And then there are 2 parks or 2 playgrounds? At least a park and a playground that they're going to be auditing along with sidewalks and crosswalks with an eye on the built environment. Those audits are actually going to be conducted on Thursday. We're going to get feedback from the girls afterwards on what they found and what they would like to see. So we're going to be asking about either infrastructure changes and or wayfinding. So what signs would they like to see? Do they even know that these parks and playgrounds were here? What would they need to see to notice that those things are there? And how do we communicate that information then with people who either live around the area or work in the area or might be visiting? That's an opportunity to build on. So we have an opportunity to build on that project. We have a small amount of funding that we hope to use to potentially create maps that would connect people to the physical activity and healthy eating opportunities here in this area. If we can get these pieces done. So basically we're going from 22nd to 25th Street. For those of you who know anything about where Children's Mercy's campus sits. If we do these, if this goes well, we hope to then expand beyond this area. So we want to go farther south to 27th, where there's another inclusive playground. We'd like to go west to Crown Center, where there's a splash pad, museums, shopping, and there's Washington Park that the city seems to have an interest in improving. We'd like to go farther north to connect to whether it's entertainment and potentially a path that the city is interested in putting in around the downtown area. So it would be a loop. I don't know if you've heard of the Green Line project. That's part of Imagine KC, their strategic vision for the next 20 years. And then we'd like to connect potentially east to get people to the health department, potentially beyond homes where you can access University Health Medical Center and UMKC. But farther east of that are behavioral health services that are important for people who might be coming to this area. So that's sort of our vision. So with a little bit of extra funding, we hopefully would be able to create, design, install signage in the area advocate for improvements. We know infrastructure improvements are crazy expensive. We don't have enough money to do that, but if we can better identify what those are, track it over time, continue to help young girls in this setting, we're hoping to any other participants in a project like this, but help them become advocates and understand the value of this, I think would be really exciting.
I love that. It's so cool.
Yeah, it's integrating all these different things into together. Like, and you mentioned about the mental health aspect, and I was thinking of it just before that. Is, you know, we had a VA group that we went out regularly, and one of the things they do within the whole health program is they have they come in, they get bikes here, in particular bikes or walking, but have a meeting place where they walk. They do group therapy for the vets. They do music therapy. You know, you can go, you're together, you're walking, exercising, and going to a location. They go to I think the art gallery, you know, provides the Nelson would provide like a art therapy program for them, or a music venue where they do music therapy. You know, it integrates an event and then exercise, and then another piece to it. And that leads into what you were just saying about signage and linking the Washington Park. You know, that lands right there at the new railroad that we're getting going from the river out to 51st Street down here, and it'll be done before we know it. So it'll be linking those walking, exercising pieces with, you know, you can hop on the bus or you can take the train, and it starts changing the dynamic of how we get to our groceries, how we go to, you know, church, how we go visit our friends. You don't always have to hop in the car when we have those assets that are, you know, connecting those ways. So it's exciting. The green line is another thing that is coming. It's not just a vision, it's real, and it's coming. So that also pulls in ways that maybe when they're doing their audit, they could, you know, have it might be fun to do like a scavenger hunt, like they can go to, make sure they can go to a store where they can get you know, an item, and then they can go somewhere where they could, you know, the different components of a day that are, I'm just thinking of kind of an event. I'm brainstorming here, but
Well, speaking of scavenger hunts, so we have connected with the Ronald McDonald House. They have 2 gardens. This is the location that's just south of Children's Mercy. We have a room within the hospital, but this is a freestanding house where families can come and stay when their children are receiving services here at Children's Mercy. They have a garden. That produce is used specifically for the family staying at the Ronald McDonald House. But what they are working on is a scavenger hunt so that their families know that they have these gardens and that they have access to them. We are partnering with them to potentially develop a scavenger hunt between the 2 gardens, so that people have an opportunity to get outside, understand what's within a few blocks of where they're staying, other opportunities to spend time in nature. Anyway, so we're hoping that we can develop a free, well, it's not free to us, but it would be free to them, scavenger hunt that they could do on an ongoing basis, simply for fun and to get connected to the neighborhood.
Yeah, it could be something where they have cultural too. I think it's always good to have, you know, a necessity where, and I'm thinking more in the big picture of the community, where you could teaching families, you know, how do you get to the grocery store to get your food? How do you go to a cultural event, get to the park, you know, in different, you know, you could have 5 different avenues of experience that typically occur in a family, how they move around, you know, and each one could be the scavenger hunt where they go to, like I say, maybe it's I don't want to say a music venue, but an event, the market, a place of faith, you know, where the library, to their school, where they touch on, and it would be an adventure that they go to each one of these places. You call it a scavenger hunt, but it would be more of a recreation of where they can access these different places through kind of a game type scavenger event.
Yeah, that sounds fun. I love scavenger hunts. So if you guys have ideas, start, formulating those, writing them down so we can discuss them a little bit more. I was just going to bring up, the website, the Kansas City Physical Activity website, and just remind you of the different sectors here. So schools, early childhood, infrastructure, parks and recreation, faith-based, healthcare, sports, mass media, business and industry, and public health. So thinking about those different sectors when you're thinking about cross collaboration.
Yes.
And then just to remind you, since I needed reminded myself, we just had the 4 strategies. I was just gonna read them real quick. So healthcare systems should partner with other sectors to promote access to evidence-based physical activity related services and reduce health disparities. So we talked about that a lot. Healthcare systems should increase the priority of physical activity assessment, advice, and promotion. Healthcare providers and professional societies should recognize that physical inactivity and insufficient physical activity are treatable and preventable conditions with profound health and cost implications. And then the last one is that universities, postgraduate training programs, and professional societies should include basic physical activity education and the training of all healthcare professionals. So, and then obviously we have the tactics underneath each of those. But going back to the main website, that's where you can get the different sectors, all the different health strategies within those sectors. So just a reminder. I need a reminding.
Do we have any representation from the payers on any of these, on this committee? Any from United?
Nope.
There's no one from that area. Yeah.
No, it would be great if we did for the billing and reimbursement stuff.
Yeah, well, I mean, yeah, that and just the whole, they're along with the providers, they're the other half of this. The data needs to be shared in collaboration with when you bill and the outcomes, they're the ones that are going to take the outcomes and evaluate the reimbursement and the, making people healthier and tracking it and what the cost and benefits are. So it would be like I think of Blue Cross Kansas City, but any of the bigger Centene, United Health, it would be nice to have feedback from them on some of this. That might be something I could try to recruit somebody from one of the payers in here. Well, I'm just thinking out loud.
I think that's a really good idea.
Yeah, they need to hear from this side, and we need to see, because they could, that knocks down the barrier and really makes things move quickly. And another part of that would be Cerner. They're a local company here. They're owned by Oracle now, but they're a hometown, medical healthcare data. I don't want to say giant, but they're taking the data, they're using it, they're evaluating it, and that's what we're talking about here with this outcomes and lifestyle changes.
Yeah, definitely. And Geetha, thank you for joining us and putting your ideas in the chat. Do you have anything else you want to expand on that?
Thank you for having me today. Yeah, I was just wondering, with winter around the corner and a lot of outdoor activities will get restricted either due to holidays or the weather itself, and we have that recurring every year, it would help, or maybe there are already some ideas floating around for the weather and indoor activities, but just thought I'll bring it up if you haven't thought of that already. It could be either some equipment or with minimal equipment, like skipping rope or a hula hoop. Kids are very active and it would be minimal cost. Schools could have it. They could make competitions or challenges. Kids always love challenges. Something along those lines, maybe. That was my thoughts.
Yeah, I love that. I definitely talk to my patients a lot about indoor activities like dancing to videos on YouTube, or jump roping is always a good idea, especially if they have a garage or something that they can go out into the garage at least and do something like that. But that would be a very interesting funded project too that we could talk about.
Yeah, or even inter-school challenges. If they set up inter-school teams, that might push it a notch higher for kids to be motivated. They always like to go for the winning, winning team or winning activity, use that to their advantage.
Helps for my kids.
I was gonna say something. Shelley has been working on doing some little videos, like some brain break videos and things like that. And she and I have been talking. I don't know how much further it's gone since she and I last talked, but trying to get some kids of all different walks, some adaptive kids in wheelchairs and stuff like that as well in these videos, so that kids can see, maybe one of our physical therapists kind of explain some stuff, or one of our athletic trainers explain some stuff, have a kid or two in the video, and ideally we'd like to get some professional athletes or some local celebrities involved, and that's maybe the biggest hiccup on that. But that would be some good indoor activity, wintertime activity stuff. And then I also want to say, Geeta Kamath, this is who I was talking about, who's over at University Health, who's helping with the curriculum stuff. So welcome to the group. Appreciate you joining us.
Thank you for having me. Love this.
This is so exciting. I can see all of your guys' wheels churning. So please start, like I said, start writing these down. If anyone has something that they're ready to submit by the December meeting, then let's start getting on that. But it might even be the March meeting that we have more formal process ready. And I don't think there's like a rush on this unless you really want / need that $10,000 right now to get that going. But I think that we could have, 2 or 3 projects within this that we could start with. And then, like I said, hopefully there'll be more funding in the future if things turn out really well. So anyone, so that's right. Shelley and I were going to talk about our next meeting, and due to the holidays and just, go ahead, Shelley.
I want to, let's talk about that. And then I do want to give Caitlin an opportunity to share a program that I just recently heard about within the last couple of weeks. That's at Children's Mercy.
Okay, why don't you go first, Caitlin?
Caitlin, it doesn't look like you're muted, but we can't hear you.
Can you hear me now?
Yeah.
Yes, okay. I had to borrow Dr. Chang's computer, and he has this headset set up, and I don't use that, and so I'm trying to figure out, and I don't use Zoom very often either. Okay, but Shelley, thanks for inviting me. I work in the Heart Center, and I recently started as the Project Adam coordinator. Project Adam has been at Children's Mercy for a couple years, but it really hasn't had a chance to grow, and hopefully with the addition of myself as the coordinator, I can get some momentum to grow it. But Project Adam is a nationwide community outreach program that helps schools, community sites, youth sports teams become, we call them heart safe. And so it encourages them to be prepared and have a set plan for if and when somebody were to have a cardiac arrest. So it's more than just having an AED on site, because AEDs are very popular and very common. They're not always available, but a lot of places have AEDs, but they don't have a practice plan and aren't prepared to know how to use it. So Project Adam helps them develop a written emergency response plan and helps them practice a drill, like very similar to a fire drill, but it would be for if somebody were to have a cardiac arrest, and you just help them kind of develop that plan to be prepared if they were to ever need it. And it's in schools, it's in like community sites and youth sports teams. And it's a nationwide program that is really getting a lot of momentum. And, the goal is to have all schools be heart safe, and reaching out to the youth sport programs. So like AAU events and baseball facilities, and making sure that they're all prepared. We have I work on the electrophysiology team, so we see a lot of those kids who have cardiac arrest when they're playing sports that come in and luckily have survived and if they're, the stars happened to align for them and they were, they did get an AED on within a couple minutes. And that's really what our goal is to just have them, is to save lives by empowering them to be prepared. So it's not quite activity like you guys are all talking about, but it does kind of cross together. Jay, yes. I actually have been talking with somebody. I'm in the CLA, it's a Clinical Leadership Academy, and there's a physical trainer who is in my class as well. Her name's Karen. Do you know who Karen is? Yeah.
Yep. Yeah.
Okay.
She's one of our
I
athletic
remember
trainers.
that because
Yeah.
she's like, yes, my name is Karen.
Yeah.
But yeah, so I wanted to chat with you guys to see if there were any collaborations between our departments, and I really want to do a Just Walk with Shelly probably in the spring. But and if it is, doing CPR education and doing maybe training with schools and really empowering students to be a part of these programs as well, I think is something that we could all do. So
That's an awesome program. I think that really ties into the sports sector. I mean, I think it ties into the healthcare sector, but I think it might actually tie into the sports sector more. One of the things we're trying to do over there is create sort of a standard of care for all youth sports organizations, like things that all the coaches have to know, the players and the parents and stuff. And that was going to be part of it, but that would be the perfect collaboration.
So Project Adam has recently created their youth sports program, like checklist and like things that we don't require, but like that are the recommendations for making you be designated as like a heart safe youth sport program. So some of that work has already been done, and I'm happy to share it with you guys, and we can collaborate and figure out how to do that together.
Cool.
Yeah, Jay, thanks for bringing that up. This was our soonest sector meeting.
Yeah.
And I think this conversation at a Just Walk makes sense.
Mhm,
And I
Yeah.
wanted her to get connected to sports and schools.
mhm.
Yeah. Perfect.
Is there a way for Caitlin, for people
I
to
gotta
get
go.
AEDs at like a reduced price, or how do people access that?
Yeah, so we work with several AED companies that do offer discounted prices. And there's also this a crowdfunding site that we really like to use, that people can create a campaign. And once the campaign foundation has, whatever, like the donation amount has been met, they provide an AED with the cabinet, and they send it to you, and then you can install it. So there's a couple different ways that we can help get AEDs. We do not provide AEDs.
Mhm.
We're not there financially yet, but maybe one of these days we could get a fund that we could help, low economic schools or community sites get AEDs. That would be something in the future, but that just has not grown into the wheelhouse quite yet.
Okay, great. Thanks, Geetha. Thanks for everyone who has to hop off. Just randomly, how much are they usually, Caitlin? Do you know?
About $1,200.
Okay. All right. Well, this is very interesting information, and we'll be excited to have you on one of our Just Walk events for sure. And then everyone who's hopping off, we'll send out an email, but I think January 31st is what we were thinking for our next meeting, which will give us plenty of times over the holiday to start thinking about our projects and recap after the new year. So we'll send out a invite for that.
Yes, we'll set that up, but don't hesitate to reach out to Jody, myself, or anybody else on the weighing in team if you have ideas for projects that we'd like to submit for the December core work group meeting to review. We can do that through email. And since we have everyone's email addresses, we can share the information a little bit more broadly. So don't hesitate to reach out with ideas.
Thanks, everyone. It's so wonderful hearing from you all. Have a good day.
Thank you.
Bye.
Thank you. Have a great week.
Evelyn, I'm gonna respond to you in this chat. Is that okay?
Yeah, I can.
Okay, I guess I can talk to you about it now. But Shelly and I had met last week, and she told me about the newsletter and said
Hold
that
on.
I could have.
Caitlin,
Oh, am I
Evelyn,
muted still?